Women's Health on the Go, where we connect you to women's health services. And tonight we have a wonderful guest, Dr. Ashley Hokut of Blue Door Physical Therapy. She's got her doctorate in physical therapy, and she specializes in pelvic health and wellness. Welcome, Ashley, to our show tonight.
Thank you. Thank you for having me.
I'm so excited to have Ashley because I think that I've met Ashley, and I think that this is a very unique and special. Having you on the show is going to open up women to a brand new area of physical health for us. So I'm very excited to have you on. As with all my guests, when I have them come on, I say, tell us about yourself. Tell us, how did you get involved in physical therapy, and then how did you wean yourself into specializing in pelvic health? All right, everybody. Tonight is a great night to be having technical problems. And we do totally apologize for this. As you know, if you watch my shows regularly, sometimes this happens, unfortunately. So I'm going to ask Ashley to repeat herself. We were just starting the show, and she was introducing herself and telling us how she's gotten all into pelvic health with physical therapy. So it's all of you again, Ashley. I'm so sorry.
Okay, no worries. I started my journey with physical therapy with a pure interest in sports and orthopedics, and that all stemmed from my background as a child with various sport injuries, and I had my own physical therapy. I had no clue that there was any other type of physical therapy other than sports and orthopedics. So then in physical therapy school, I actually learned there were many different avenues you could take. And I just forged ahead into the ortho track. That was my passion. However, I did take one elective in women's health when I was in school. But I just kind of stuck that on the back burner. I never really thought much about it. And after physical therapy school, I worked at a few different outpatient orthopedic clinics, and I saw anything from patients after car accidents, rotator cuff repairs, ACL surgeries, various bone fractures, ankle fractures, hip pain, like basically everything, from babies with torticollis to like a 94-year-old woman who had neck pain. So anyways, it really wasn't until I had my own childbirth experiences did I even get an awareness or an appreciation for pelvic health. I had my own journey and challenging recovery after my first childbirth, and I actually didn't know anybody could really help me. And I'm a physical therapist, and I still didn't know that I could get help. I mentioned it to the doctors, but you'll get better with just time. And it did. It got better in time, and doing kind of my own stuff to help myself heal, and had a second child pretty quickly. So after the first, which was physically quite challenging, I don't think I actually was fully ready for that. After the first, and I realized, well, if I don't know that much about this, and the public probably doesn't know that much about it, and I think there's a lot of women out there that could get help. And I really just was thinking in the pre and postnatal care, and then once I started doing more research and studying and reading books, I realized, whoa, there is so much that we take for granted I guess.
Okay, everybody. As you can see, we're having lots of technical issues tonight, but Ashley has been so wonderful to stick with us. So hopefully that this is going to keep going. We're going to basically jump off right where we were, okay? So Ashley, I know you were talking about how you're going through your own experience and just how not every woman out there is going to possibly have the knowledge about pelvic health. So I don't know if you remember, but kind of continue from there.
Right. So I basically realized that if I, as a physical therapist, didn't even know that I could get help after my childbirth and needing some healing and recovery, then how many other women also don't know about the plethora of assistance they could get after childbirth. And so I started studying, reading books, going to classes and training with the pelvic health specialty. And I learned even more that, wow, it's not just prenatal and postnatal care. It's huge.
Yeah.
It's incontinence. It's pain with intercourse. It's pelvic organ prolapse. So many things that pelvic health physical therapists are able to help women and men with. But yeah.
I think it's amazing because I know that when I found you and I kind of reached out to you, it was something even, I mean, I've been doing, gynecology, for so long, and even I didn't really even know about that there was pelvic health, physical therapy, and it is such a unique area, and I really do believe that lots of women need to know about this. That's why I was excited to have you on the show. But I think it's also interesting how a lot of us have something happen to us, and that's how our careers kind of just roll into what we end up specializing in. So when we talk about, most of the people out there, we all know what physical therapy is, but what is the difference between just regular kind of physical therapy and pelvic health physical therapy?
Right. So pelvic health physical therapists, it's all postgraduate learning and training. You're not really taught this in school. When I took my elective, we got information, but we were not trained in this. So basically, I guess I'll start out with, I have a little model that
awesome.
I show people.
Yes.
To pelvis.
Oh,
Okay.
I love it.
Because I'm very visual, and I figured it's easier to kind of explain this with this little model. So this is the pelvis, okay, right here. This is like almost where when people put their hands on their hips, it's really up here on their pelvis usually.
Yeah.
This is the pubic bone is in the front. This is part of the lumbar spine at the low back. And if I turn it around, I think you can maybe see it. Yeah. This is the sacrum and then the tailbone. Yeah. And if I just kind of turned it this way, actually it might be easier if I, this is fine. This is someone laying upside down, and then this would be looking between their legs. Mm-hmm. So these are the sit bones, and there's all these muscles between that area, between the pubic bone, the tailbone, and the two sit bones. Yeah. And within the muscles, there are 3 openings for the female. The anus, the vagina, and the urethra. So I can turn it this way. Yeah. Right? Here it is. It's a little easier. Yeah. So, sorry, everybody, if it's too much information, but this is what we do.
This is perfect.
And if you look inside, you can see the muscles, how they span within kind of the basin of this pelvis. So these muscles do more than just supporting the organs. They provide stability for your body, like your core, right? Yeah. This is also kind of part of your core. They control the sphincters. So for continence, they keep you continence, fecal, for bowel and bladder. And sexual, they have a sexual function, for pleasure. So the beauty of pelvic health physical therapy is you're not just doing musculoskeletal, which is right, the bones and the joints and the muscles, that's all part of it. Right. But you also get to do like bowel and bladder. You get to help people with things that have such an impact on their life. You're working with helping them keep pee and poo off the floor, I mean, that's great. And sexual pleasure, and it's never normal to have pain with intercourse, but so many women do, and they don't know who to go to tell. Because if they tell their doctor, what is it, if they're not trained in it, they don't know where to send them. No, absolutely. They're often told to have a glass of wine and go, work it out. And it becomes like more than just a a physical condition. It really has an emotional
Oh yeah, absolutely.
part of it, and also since it's bowel and bladder, the bowels have to do with nutrition and like what you're eating every day and just movement, and so it's really a holistic kind of style of therapy. So you really have to look at the person more than just the muscles and the bones and how they're moving. You have to think about their emotions and behaviors and daily habits and stuff like that.
No, absolutely. Now, what would just to give everybody kind of like common diagnoses that you would actually like,
Yeah.
you know, like I'm thinking like a uterine prolapse, like, you know, what kind of diagnosis, like if someone's watching this and they go, oh, you know, I have that, you know, what kind of diagnoses are commonly that you can help?
Yeah, so if you think about the musculoskeletal aspect of it, and I showed you where everything is so close to, low back pain can be pelvic floor dysfunction, hip and joint. I mean, the hip goes right here, and these muscles come around to the hip as well. Coccyx or tailbone pain, pubic bone pain, which I get a lot with my pregnant women. And then if you think about the bladder, that's urinary incontinence, could be stress incontinence, urge incontinence, it could be frequency or hesitancy, overactive bladder or even painful bladder syndrome / interstitial cystitis. Or a bladder prolapse, which is a cystocele when it comes through the anterior wall of the vagina.
I'm assuming that a rectocele as well?
A rectocele from the posterior wall of the vagina, and then rectal prolapse, which is just the rectum out of its own opening. You had mentioned the uterine prolapse. The other bowel dysfunctions are chronic constipation, IBS, irritable bowel syndrome, or fecal incontinence, which again, postnatal, if you think of episiotomies and tearing, they're pretty prone to the fecal incontinence. And it's huge. It's like no one thinks about. If everything's going smooth, great. And then something happens, whoa, this has such an impact on your life.
Oh, no, absolutely.
Yeah, and the pre- and postnatal care. For postnatal, I work a lot on women who've had C-sections on their scar and rehabilitating and kind of getting their belly back and their breathing patterns back and how to safely return to exercise because everyone's aching to kind of get moving again, which is great, should, but I really want to prevent prolapse. I want to prevent urinary incontinence from happening. So many postnatal women are like, every time I sneeze, I pee. And I guess that's normal because look at the aisles in Walgreens and I can see all these pads that you're supposed to wear. So I guess I'm supposed to wear them, but you're not.
Yeah, no.
They're there, you know, it's like a Band-Aid.
Exactly.
But it doesn't fix the problem.
Exactly.
Yeah.
Now let's just suppose I got something going on down there and I come and see you. Like, what is that, like, what does the initial exam look like? Is it like, what exactly, how does it all look?
Yeah, so it always starts with a thorough medical history. Every patient that comes in has a totally different story, and I spend an ample time just listening to them and hearing them out and letting them know, you know, they're not alone and what they're feeling is real, because a lot of them don't even get the time to be heard. So I feel like that's really important. These women need to be heard. And then after that, I kind of start with posture. I want to see kind of where they're at, standing, sitting, how they move, since the pelvic floor is related to the hip and the back and everything. I want to see how just their normal range of motion is, hip, back, how does their belly feel, is it distended, stuff like that. And then when you actually get to the pelvic floor assessment, depending on the patient, I don't always assess it on day one with patients if they're not at that point where they're ready for it. But what it is, it's not a pelvic exam. There's not a speculum involved or anything like that. It's a one finger assessment, and you can go in through the vagina or the rectum, and you can feel these muscles. So you're just through here, the vagina. You can feel the muscles inside. And you can feel for tone. You can see, is there any tenderness anywhere? Are there trigger points? Are they able to contract muscles? Just like a regular physical therapist might want to see how your bicep is, right? How strong you are, and they want to test that strength. This is how you test the strength of the pelvic floor. Because you don't want, not every patient that comes in needs Kegels. Not everybody's weak.
Okay.
Some people are just, they have overactivity, and they're having pain and trigger points, and what they need is actually down training and relaxation techniques. But you don't know that if you don't have a baseline to assess, when you assess them. So you're assessing tone and muscle function and strength and things like that.
So, and I guess from that you come up with a plan, like, some kind of, do you do physical therapy with you, and then do you take home homework? Like, how often would you come to see you? Like, how does that?
Yeah, I always give my patients something on the first day, and it might not be a typical exercise. It might just be, let's just work on your awareness of your pelvic floor. Can you feel it? What happens when you're breathing? Like, let's just start at the baseline, the basics. It might be some stretches. It might be some strengthening. It really depends on where they're at. But I base it on where they're starting. And I give maybe one or two things to go home with, because nobody's going to remember or want to do more than that anyways.
Yeah.
So usually my patients come either once a week in the beginning for a few weeks, and then as they start to be able to do more on their own at home and gain that awareness and know where they're going, every other week. Then I have people who, again, they skip 3 weeks. It really just, it kind of varies. But I usually start, once a week.
Okay. And I'm assuming that it's also going to depend, like, how long it will take. Like, I have a uterine, I'm starting to get a uterine prolapse, I guess it's going to kind of depend on how long I have to see you, depending on my improvement in myself and my body, I'm assuming, right?
Right.
Like, it's not typical kind of length of therapy.
I don't really have a typical length. It depends on a few things. It depends on the patient's ability to do things at home, their own awareness, their symptoms. So if their symptoms start to go away, and then they have the awareness of how to continue and progress, then they can kind of do that on their own. And then maybe it's like, come in a month and check in with me and let's see where you're at. Maybe you need to progress some more. The longer people have a symptom for, the longer it takes to heal.
Yeah.
So usually if it's a chronic pain patient, like a pelvic pain patient, if they've been in pain for years, then it's going to take a long time for that to really heal. And they have a lot of work ahead of them. But if they continue on the journey, they'll get there.
Now, is there, and I just thought of this kind of question inside my head, is there anything like, okay, I call myself young, I'm getting older in age, but is there things like, could people come to you even like before, and say, listen, I don't want to have these problems later in life, do you have like a recommendation of, pelvic exercises?
Like preventative medicine.
Yeah.
Right?
Does that
absolutely. Yeah, absolutely. So say you're someone who's active and you work out and you don't have any symptoms yet, but I could just do an assessment and see, well, let's see where your strength is. How is your muscle tone? How is it working? What are your goals? Like what kind of exercises do you want to do? Are you a runner and you just want to make sure you're running? A lot of it is cross training, like not just doing one thing, but doing a multitude of things so that your full body kind of gets a good workout. There's also other things you can do to prevent, like prolapse is usually a pressure thing. Well, in addition to some connective tissue weaknesses and stuff.
Yeah.
So, or incontinence, stress incontinence, laughing and sneezing is usually like not managing your pressure well through your belly and down the bladder. Right up here, here's the bladder.
Yep.
Contracting, and the pelvic floor not being able to really respond well. So maybe you're great when you're young, but you have like chronic constipation and you're straining and bearing down.
Yep.
So learning techniques of how to manage constipation will help you later in life. Learning how to breathe with movements so you're not bearing down. Or if you're doing some heavy lifting and maybe you do have to do a breath hold technique, that you're actually spreading out those forces more evenly and you're not putting all of the pressure down, but like kind of out throughout your whole system and core.
Okay.
So yeah, there's preventative things that people can do for sure.
So this is not only for people who are having problems, it's also a good idea to maybe come see you even just when you're I always say that I'm getting younger.
Yeah.
Makes me feel better. So, I'm getting younger every year, and I know that as I get younger, these things start to happen. It's a good idea to even come and see you just to prevent those problems.
Yeah.
When we get really young.
Exactly. Preventative is key.
No, I totally.
Easier to prevent a problem than fix something. And it's easier to fix a problem that is recent than one that has been going on for a very long time.
No, absolutely. And I know that you do some classes as well, right?
Yes. So I created a prenatal pelvic self-care class to educate women on this part of their body and gain awareness of this part of their body. To prepare them for labor and delivery. Because a lot of people are told push, and they're like, I don't even know what that means. Yeah. I don't know what push is. What are you talking about? Yeah. There are some now, I guess, new studies out there about like the uterus doing its job and like breathing and letting it go, but they also don't know how to relax and let their pelvic floor go and let it open and spread. And I teach some pelvic mobility exercises to kind of get your that pelvic area. I don't know where I just stuck my model here. To kind of get these bones moving a little bit better so that there's more space for the baby to come out. And I teach them some techniques on how to kind of like lift their babies and stuff for postnatal as well in that class.
Oh, that's good too. Now, when you say about, just a question popped up in my head, when you're preparing them prior to labor and just about the whole muscles and stuff like that, do you know if it also maybe helps a little prevention with like episiotomy?
Yeah, so the research on that is a little bit iffy one way or the other, whether it actually prevents episiotomies. I think that there's so many factors in the labor and delivery that maybe that's why it's questionable. So I teach them to do the massage, the perineal massage, and how to work it more for awareness so they can feel the area and be able to kind of relax into the sensation of stretch, if that makes sense.
Okay.
Because, like, say this is the tissue, and it's only felt kind of like this very gentle pull before, and that's all it knows. And then out comes the babe, and it's like this bigger stretch, and your body is going to perceive that as like danger.
Yes. And you're going to automatically contract.
And then they're going to contract when fear comes over you. Pain is more intense. Yeah. Right? The neuroscience of pain, when your body perceives danger, it's going to fire more pain signals out. Yeah. So it's kind of like preparation for that stretch sensation, so you can say, this is okay. Like, I've felt this kind of before. It's not going to, that kind of thing. So gaining awareness, I'm not sure if it really will change the rate of
Yeah.
episiotomies. There's evidence for it, and then there's evidence against it if you read literature. So,
and I also think
it's also wonderful.
Oh, I think that it's definitely wonderful, but I think that also depends on who's delivering you as well. Like there's so many dynamics.
The stress, your stress hormones that you're experiencing when you're delivering. Again, if you have that fear, and your cortisol levels are higher than your natural, this inverse relationship. This is stuff I actually talk about in my class to kind of get people to understand it, so they are like, oh, now I know why I need to like kick these people out of the room when I'm in labor, because I need a relaxing environment. It makes sense.
This almost sounds like better than Lamaze class.
Yeah.
I mean, it's because, Lamaze, I mean, what are they? They're just going to go, do your he, your who, and, and push. But this seems like you're getting so much more, because you're teaching them the whole dynamics of what's going on and how it's happening,
Right.
You can he and who, but this is what's really happening. And I think that's really great, actually.
Yeah, it actually goes really well with some other prenatal classes, because it's different. It kind of adds another element to it.
Yeah.
So you can take other classes and then take this, and this isn't really being taught at all.
So is that something that you just do in person, or do you have any other ways of doing the class? Like, how are you doing the classes?
Right now the classes are in person.
Okay.
I offer it quarterly at Waddle and Swaddle.
Okay.
And it's up on my website, and it's up on their website. And I'm in the process of hopefully creating an online version for people who can't really get out there and get the information.
No, that would be definitely awesome. Now, what about too, like, because we have people that, I mean, we're here, Beacon, New York, we're in New York, and there may be some people that might not be watching necessarily in New York. Is there any way that, let's just suppose, maybe they're seeing someone, but they need to have a little bit more understanding or a little bit more education or something like that. Is there any way that you do, like, education, like Women's Health on the Go? We do video consultations with people. Do you have that same kind of service for women?
I do. I have video consultations for women. They just need to be heard. They need to tell their story to someone who's going to listen to them, and then I can help guide them. Like, what's the next step in your healing process? Who else do you need to actually see and go to who can help you with this journey? Give them some education on their condition and what's going on if they've already had a diagnosis. I don't, provide necessarily the skilled physical therapy treatment, because I'm not doing an assessment, but the education and the knowledge that, you're going to be okay, and I'm listening to you, and I hear you out, and let me just help you through this process, because support is just, who can go through life without support? It's a huge part of everybody's healing process.
No, I totally agree with you. I mean, the reason why I do this too is, like, a lot of people go to a doctor's office and they give them 5 minutes and say, okay, and move on. And women need to talk to somebody in regards to a lot of stuff, when it comes to a lot of things, and you have to feel comfortable, especially when it comes to women with pain with sex,
Yeah.
Sometimes women are ashamed to have that conversation, and we shouldn't be, I mean, this is, sex is, it's a wonderful thing. It's very natural, and we need to be like, if we're having a problem, because if we're not having sex, like, we might not be very happy.
I know. So many women suffer in silence because they don't even just know where to begin.
Yeah.
So physical therapists are a great source, a great way to begin. We can spend the time.
Yeah, no, I think what you do is really, it's amazing, and it's opened up my mind as well, because, like I said, I know mostly about, like, physical therapy, and I've heard of different kind of pelvic, health people, but the whole pelvic health for physical therapy, it's been amazing. I'm learning about it, and I'm very happy that you decided to come on the show.
Thank you. Thank you for having me. This is great.
No. So that's really kind of it, everybody. I wanted to, to definitely have Ashley on the show to, I'm always bringing things on the show to introduce you to new ways that we can heal ourselves. We're women, we're amazing, we need to help each other, and I hope that you enjoyed the show. I'm so sorry about the little technical glitches in the beginning, and I apologize to Ashley as well, but I'm going to put this all together so that we can post it up and spread this knowledge, spread this video if you think someone out there, because I know there are a lot of women out there that have pelvic health issues. Spread this video out there. I think it's really, really great knowledge. Again, thank you so much, Ashley, for coming on the show tonight. I really appreciate your time, and that's about it. Thank you so much, Ashley.
Thank you.
All right, everybody, good night. Have a great week. I am going to be off next week. I'm going on a little mini vacation, but I will be back the following week, and I'm going to have another guest. So we'll see how that goes. Hopefully our video will go a little bit smoother next time. But thank you, everybody. Thank you, Ashley, and we will see you in 2 weeks, everybody. Take care.